in this video we are going to discuss about ruptured ectopic pregnancy. So first let us see what is ectopic pregnancy. So ectopic pregnancy is that the implantation occurs outside uterus. We already know that the normal pregnancy is a intrauterine pregnancy, but here ectopic means the implantation is going outside the uterus. Okay, so that is the main point, implantation out of uterus. So this is an abnormality. It's a normal, not common type of pregnancy. So ectopic pregnancy is divided into three types. That is, you need to see that ectopic pregnancy is the most common site. What is the most common site overall? The overall most common site of ectopic pregnancy is fallopian tube, because we know that in the fallopian tube, especially in the ampulla, there is fertilization process, formation of zygote, and in that ampulla only sometimes what happens is this zygote is stuck there because of many reasons. So that's why the most common site of ectopic pregnancy is fallopian tube. Next, coming to most common non-tubal site. Other than tubes, you know this fallopian tube, right? Other than fallopian tube, what is the most common site of ectopic pregnancy? That is in ovary. Sometimes you see that the zygote is going to the ovary and it is starting to form fetus over ovary. So this is non-tubal site. And if you see overall, the common site is ectopic in cesarean section. So sometimes what happens is after cesarean section of previous pregnancy, sometimes in some cases, only like 0.1 cases we can say, during the second zygote it may go and form near the cesarean, but it is only seen in 0.1 patients, and also sometimes in cervical region, that is cervical ectopic. So for this, let us draw a diagram to understand this more clearly. So for example, this is the fallopian tube, this is the fimbriae of the fallopian tube, and here comes a uterus. So normally in the uterus, especially in the posterior wall near the fundus, the implant should come and implant. But here in the case of ectopic pregnancy, as we discussed, most common site in the fallopian tube. So fallopian tube is actually divided into interstitium. This is called interstitium, and this part is called as isthmus. So these are different parts of fallopian tube. Next comes the ampulla. So in the ampulla, fertilization takes place. This is the ampulla, and this is the infundibulum. So in the infundibulum only you have finger-like structures like an hand. You can see this is fimbriae. So below the fimbriae you will have the ovary, right? So this is the structure which we need to see. Now coming to intrauterine pregnancy. So intrauterine pregnancy will also happen over here, okay? Intrauterine pregnancy. But in the tubes, if you see the order, ampulla is greater than isthmus, is greater than infundibulum, is greater than interstitium. So what is this? What is the order? Here you should see what is the most common site of ectopic pregnancy. As fertilization takes place in ampulla, ampulla is the most common site of ectopic pregnancy, followed by isthmus, because isthmus is just beside it, okay? And next infundibulum, and next at last interstitium. So you can see interstitium is the most least cited, is not common site. So this is the order which we need to remember regarding ectopic pregnancy. Now coming to and one more thing, as we discuss here, overall least common, right? Overall least common is in caesarean section 0.1%, and in cervical ectopic site, which we need to remember. And one more thing, least common site of ectopic in tubes. In tubes, least common site in tubes, according to the order, you can say clearly that is the interstitium. In the interstitium, there is least chance of ectopic pregnancy. Okay. Now coming to corneal pregnancy and intrauterine pregnancy. What is this? Corneal pregnancy and intrauterine pregnancy. Corneal pregnancy is an actual pregnancy which occurs in interstitium. So if the pregnancy is in the interstitium, then it is called as corneal pregnancy, also called as rudimentary rudimentary horn of bicornuate uterus. So this part, this interstitium, is also called as rudimentary horn of bicornuate uterus. Next, coming to intrauterine pregnancy. Intrauterine pregnancy is close to angles of uterus. So what is angle of uterus? First you need to understand this area is called angle of uterus between the fallopian tube. You can see this area is called angle of uterus. So in the angle of uterus, if we have implantation, that is normal pregnancy. And next, coming to and this pregnancy is also called as angular pregnancy. Now coming to corneal pregnancy. Corneal pregnancy is where embryo lies lateral to round ligament. So first we need to understand where is round ligament and where is our ovarian ligament. Okay, so this ligament you have, this is a round ligament and this is the ovarian ligament. So these structures are very important to understand. This corneal pregnancy means embryo which is at the lateral to round ligament. In this diagram you can see this is the round ligament, lateral to it. Here you will have exactly corneal pregnancy. And next, coming to another pregnancy, that is angular pregnancy. Angular pregnancy is medial to round ligament. So you can see this is the round ligament, so medial to it, somewhere over here will be the angular pregnancy. So these two pregnancies are important. Now coming to Rto structures. Rto structures are nothing but round ligament, fallopian tube and ovarian ligament. These three structures, anterior to posterior, if you see the structures attached in the angle or corner of uterus is Rto. Outcome of ectopic pregnancy. Now let us see what is the outcome of ectopic pregnancy. Either the ectopic pregnancy may abort or the ectopic pregnancy may continue to grow. So if the ectopic pregnancy will abort, then mostly it will abort in the tubal abortion. That is, in the tubes the ectopic pregnancy is getting aborted, and in that also in the ampulla, in the infundibulum, it is the most common site to get aborted. Next, coming to continue to grow. Outcome is sometimes this ectopic pregnancy continue to grow, that is called as tubal rupture. If it is continue to grow, it is rupturing the tubes. So this most common site is seen in isthmus and interstitium. So let me show this in the diagram, then we'll understand it clearly. So in this diagram, if you see here, outcome of ectopic pregnancy, in the case of abortion it will be in tubal abortion, that too especially in ampulla there will be abortion, and also in the infundibulum. So these two sites are most common for abortion. Next, coming to continuation, that is tubal rupture. Tubal rupture is most common in isthmus and interstitium. So this is the sites which we need to remember. Now coming to another thing, that what is more common. In the case of abortion, the ampulla is most common, and in the case of tubal rupture, isthmus is most common when compared with interstitium, and here when compared with infundibulum. Okay, so ampulla most common for abortion, A for A, we can remember like that, ampulla, abortion, A for A. And in the case of isthmus, we need to remember that isthmus is most common site of tubal rupture. Now coming to some important points, like ectopic pregnancy is divided into 3 times according to time period, like which will end earlier. The ectopic pregnancy which will end earlier is in the isthmus, and which last longer time period in the fallopian tube is the interstitium. Why? Let us see all those reasons also. And which will last longest overall, okay, that is in abdomen and in heterotropic pregnancy. For what are this, let us understand. So actually what I'm saying is ectopic pregnancy timelines. If you see which ectopic pregnancy will end very fast, that is isthmus. In the isthmus, ectopic pregnancy will end very fast, because you know isthmus is a site, most common site for tubal rupture. So that's why you can remember like that. And in which pregnancy you will see it will last for longer time, in the interstitium. Why in the interstitium it is staying for longer time? Because of myometrium. So myometrium is supporting it. So as the myometrium is supporting it, it will stay for longer time. And which will stay for longer time overall is abdomen ectopic, because abdomen there are like many structures which are supporting. And in heterotropic pregnancy, what is heterotropic pregnancy? Here there is a twin pregnancy. In twin pregnancy, the first pregnancy is intrauterine, whereas the second pregnancy is ectopic. So in this case, this is called heterotropic pregnancy. So in this case also, it will last for the longer time. So now coming to narrowest part of the fallopian tube. The narrow part of fallopian tube is interstitium. So interstitium is the narrowest part. Next coming to second narrowest part. Second narrow part is isthmus. So according to order, first you'll get interstitium, next isthmus, right? So like that we can remember. So now coming to the next last point which we discuss in this video, that ectopic pregnancy in tubes. So sometimes ectopic pregnancy in tubes is again divided into which went earlier, next into ampulla, next into last longer. So the ectopic pregnancy which will end earlier, already we discussed that is isthmus. Why? Because of in the isthmus, if it rupture, the time is 6 weeks. In the ampulla, it end by tubal abortion by 8 weeks, which will last longer in interstitium. It will rupture by 12 weeks. And remember, it is the most dangerous for ectopic pregnancy. So among all this, the most dangerous ectopic pregnancy is interstitium, because it will rupture and it is staying for longer time. Okay, so after that we'll discuss now about risk factors of ectopic pregnancy. Now let us continue with risk factors. Okay, so what are the risk factors? The highest risk of ectopic pregnancy is previous history of ectopic pregnancy is greater than tubal surgery. So sometimes the patients who are already having a past history of ectopic pregnancy, they are having higher chances when compared with tubal surgeries. So actually why this is happening? Because in the ectopic pregnancy or in the tubal surgery, there are some materials which are blocking the way to the fallopian tube into the uterine cavity. So the product which is forming there, that is a zygote, is stuck there in the tube and it is implanting there itself. So there is also chance of recurrence if the history of previous episode of ectopic pregnancy is 15%, and in the case of 2 episodes, so for 1 episode, if someone patient having 1 ectopic pregnancy in the previous, then 15% chance of getting again second time. Already they are having 2 episodes of previous ectopic pregnancy, now they have 30% chance. Okay, so now coming to the most common risk factor. So what is the most common risk factor for ectopic pregnancy? That is salpingitis. So what is the salpingitis? It is nothing but inflammation of fallopian tube, or PID. What is it? Pelvic infection. So in pelvic infection, actually there is inflammation of endometrium, that is endometriosis, salpingitis. You will see this combination, that is why it's pelvic infection. Because of this also, it is a risk factor for ectopic pregnancy. And PID, that's what I'm writing. PID includes salpingitis. Oophorytis means it is inflammation of ovary, and endometriosis, endometritis, that is it's inflammation of endometrium. Okay, so other risk factors are in vitro fertilization or art therapy. Okay, that is the other risk factor. Now coming to smoking, there's a different risk factors like in vitro fertilization, smoking, early age of intercourse, and multiple sex partners, and low socioeconomic status. All this, any adhesions inside tube, adhesions, for that sake you can take examples of endometriosis or appendicitis will also lead to these problems. And any theory of retrograde Menstruation. Retrograde menstruation is, menstruation will be in the forward direction, that is from the uterine cavity towards the vagina. But sometimes the theory of retrograde menstruation says the blood is going from the uterus to the fallopian tube and blocking them, so the zygote is blocked there. So these are the different risk factors for this ectopic pregnancy, and among this especially smoking, early age intercourse, multiple sex partners, these are the risk factors for pelvic infections because they are sexually transmitted. And next, coming to salpingitis, ischemica nodosa. This is a separate case. Salpingitis, ischemica nodosa. So what is this? Actually here the fallopian tube have pockets like this. You can see like pockets. So when the zygote is formed here, it will stuck in the pocket. It is not able to come out. It will not able to come out. So the zygote fall in the pocket of fallopian tube and implant there. So this is leading to ectopic pregnancy in this Salpingitis ischemica nodosa. So by this we completed half of our lecture, and next we'll start with the second half in another video.